Okay, yeah. So those of you who are at the MMG conference heard me speak about hormones, estrogen, progesterone, testosterone as a link in a systems biology approach in taking care of individuals, and not thinking in a linear thought process. The whole point of my discussion was not thinking linearly when taking care of patients, rather thinking from a systems biology approach in managing individuals, because it's not just about 1 + 1 is 2, 2 + 2 is 4. Low testosterone plus testosterone means a better individual or a better physiology. It's about the complexity of the balance in the systems in an individual systems, and that's the same with antioxidants, nutrition, and hormones. They all work together. So I discussed at the conference about optimizing versus functional approach, as the prevention is the primary approach to healthcare. And this is in contrast to our usual approach in medicine, and that is wait till a person gets sick and then manage that illness, manage that disease process, and then wait for the next thing to happen. My wife is a perfect example of this, where this woman that you see here in great shape, has been in great shape all her life, who's a vegetarian since she's been since she's a teenager, who's always been active, had her first heart attack at the age of 38. So why would that happen? Someone who's a vegetarian in great shape, active all her life, have a heart attack at the age of 38? Because we forget about these other outside allostatic load. We forget about all that her body works in our bodies work in a systems biology approach. So when she had these kind of minor complaints through her 20s and early 30s, we weren't thinking about looking at her overall physiologic, all the physiologic parameters to include her antioxidant levels. So after she had her heart attack, she was, of course, well taken care of by the cardiologist, who was taking care of what? Her heart, right? So, so they're taking care of her heart, but what are they forgetting? Forgetting about hormones, forgetting about nutrition, forgetting about, I mean, she's a vegetarian, so we assume that that she's eating properly, and she's not a potato chip ice cream vegetarian. She's had 4, 5, 6 servings of whole fruits and vegetables in a day, but that's all we think. We don't think about, is she absorbing? Is she? And so we didn't measure that. So make a long story short, her vitamin D, but I met her 4 years after her MI. Her antioxidant levels, as measured by the biophotonic scanner, was nil. It was 0. It was so low, it was not measurable. This is a vegetarian, right? Her vitamin D levels were I think, in the single digits. Her hormone levels were all over the place and not being managed, because all we were thinking of at that time, or her specialists were thinking of, was her heart, her lungs, but not as a systems biology approach, as a human being who needs to be looked at from the perspective of her overall health. Next page, please. So there are multiple studies correlating antioxidant status with optimizing hormone and hormone receptor function. Poor antioxidant levels, low antioxidant levels, whether you're a vegetarian or not, and you have to be measured, increase the chances for issues with hormones, including infertility, early menopause, poor sperm production, erectile dysfunction. So what we're being pushed in the mainstream perspective is, oh, erectile dysfunction, we'll give them more testosterone, or give them shots, or medications that help kind of put Band-Aids on these types of things, but don't actually fix the problem. Next slide, please. There we go. So the bottom line is estrogen, progesterone, testosterone. If you're having issues with these hormones, and you're taking care of these, and you're a physician, and I'm talking from the perspective of those of you who are listening, who attended the MMG conference, is that we in these types of conferences, we think, okay, someone's perimenopausal, and we got to manage their estrogen, progesterone, testosterone, but it's more than that. It's managing their antioxidant status. It's managing the nutrition so that the hormones that they are taking are working. Because we've all had this same patient come in that has been on hormones, and their symptoms are coming back. We don't know why. I've been on testosterone, Dr. Gonzales, for 2 years, or came from another clinic, and I have testosterone, but they won't give me more because I'm already maxed out on my testosterone. When we haven't managed their antioxidant status, their nutrition status, their receptor function. And so we don't think of it from that perspective. The animal studies and human studies, yeah, keep going. There you go. Have suggested that oxidative stress has an important role in follicular growth, in the development of things like endometriosis, infertility, regulation of angiogenesis, so of healthy vascular function. These are all citations. I'm not going to bore you with going over each and every one of these studies, but it's well established. There's nothing new about this, about antioxidant stress, oxidative response for hormone receptor function. We've known about this for years. I suggest you go through some of these citations and take a look at how all this matches, because the bottom line is this. Next slide. The bottom line is this, is that we all, and this is, I'm just using doctors, picking on doctors here on this slide, but all of us have outside stressors, and we need to manage those stressors. And oxidative stress plays a powerful role in not just hormone production, hormone receptor function, but in overall physiologic health, brain function, adrenal function, thyroid function. And we don't want to wait till somebody gets sick, until they're 38 years old, vegetarian, having an MI. So the best way to do it, and how I utilize in my practice, the biophotonic scanner, is that every single individual that walks through the door, that walks through my clinic, gets scanned. Whether they're here for an aesthetic procedure, whether they're here for nutrition, weight loss, for cancer management, whatever it is, every individual that walks through the door, including the mailman, gets their antioxidant scan, because that's the most powerful screening tool that I can do within seconds that gives me the power to give a narrative of nutrition in that individual's health. We all know that discussion of nutrition is labor intensive as physicians. This slide's more discussion, more citations, and what it correlates with. And I'm going to talk about autoimmune in a second. Stay on this slide for just a second. So we all know it's labor intensive to talk weight loss, to talk nutrition when it comes to physicians and patients. We have a short period of time. The biophotonic scanner allows a quick, it gives you a number right away that you can present to the patient and put it right in front of them and say, here it is. You either do something about it or you don't. It's what we do with all our other things too, right? Okay, your cholesterol's 285, your LDL particle numbers are over 2,000. Here it is. Your hemoglobin A1C is 6.9. Here it is. Your antioxidant levels are low. Here it is. And then you do something about it. And so what do I do about it, Dr. Gonzales? What do I do about it, doctor who's providing me healthcare? Well, first, we got to make the changes that you need in your diet. And that's the number one thing. The number one thing is not, no, you got to take a pill. No, you got to take a bunch of supplements. The number one thing is change your lifestyle and change your diet. And it brings that narrative right away. The second thing, if you want to escalate that and start right away, is begin supplementation. And powerful responses. I make every single one of my surgical patients not only take the test, of course, but if their antioxidants are low, and even if they're in the right place, I want to maximize that level, right, to allow for maximal healing. And so I put them on the products, and the products that work are the ones that show a level. How do you know a medication is going to work? Docs out there, how do you know a medication is doing its job? You measure. Well, how do you know someone's antioxidant levels are elevated? Well, you measure the biophotonic scanner. And with my wife, who had zero, she had zero, her level was so low, it was not measurable. It took me 18 months with maximizing and being aggressive with her antioxidant, with her gut health, and improving her gut and maximizing the antioxidant intake. It took me 18 months just to get her into the near optimal range, and another 3 years to get her into the optimal range. So it's not going to be easy. It's not an easy thing. It can be, but it's not an easy thing for those people who've had issues that led up to that for years, that led up to a disease process. So this is just a list on this slide. It's just a list of the different things that the citations that correlate with the different things that have to do with antioxidants and all these different issues: sleep deprivation, metabolic syndrome, sex hormone dysfunction, cardiovascular disease, MS triggers, cancer triggers, osteoporosis, autoimmunes. I want to spend just 30 seconds on discussing autoimmunes. Autoimmune issues. So when I was, keep on this slide. When we're going through medical school, Hashimoto's, autoimmune disease processes were the zebras. Now it's like everybody has some sort of autoimmune issue. Lyme's is prevalent. Hashimoto's, everybody has Hashimoto's and thyroid disease. Everybody has a gluten sensitivity and allergy process, an allergy. Why is that? Well, that's a whole nother discussion, but the bottom line is, if we're not managing the basics, if we're not managing the nutrition, the diet, and if we're not bringing the narrative early, which the biophotonic scanner does, then, people are kicking their own butts. Just